Assalamu alaikum and good evening. I think you will need a break as well, so I'll be quick to talk about our topic today. My name is Dr. Ramadan. I am the CEO for Regulation and Healthcare City Authority. We are a free zone. We do own sets of healthcare and non-healthcare. I was told that we need to talk about something to relate about blockchain in healthcare. It's a new area and lots of questions and areas being covered, and some of them are still under processing. So I'll just give you an idea about what things we did in Dubai and what things are happening, inshallah, in the near future. So this is not my presentation, first of all. Healthcare City is an authority as a free zone. We do license practitioners and hospitals. At the same time, we do license the non-healthcare like hotels and schools to make sure that there's a revenue to cover our cost in healthcare. As you know, healthcare is always costly. When we came to the issue about blockchain, we had lots of issues about healthcare and blockchain, and lots of terminology came up recently, like artificial intelligence, smart healthcare, and so on. So His Highness Sheikh Mohammed bin Rashid, always we are inspired by his talks and so on. He says in the race of excellence, there is no finish line. And in healthcare specifically, it's a big challenge. We have patients, not computers. And the patients basically is a human being. And the most difficult sector or public sector to control is patients. You are, no matter what you do, it's basically a deal between human to human, and doctor experience and patient experience. So in the old days, actually, the medicine was evolving in different ways. This is just a quick one, that medicine started really, really long time ago and different ways, but all of them, they were seeking the benefits or how to make sure that the medicine is evolving to help the patients. So it was from textbooks or from simple talks, and basically, like for example, the surgeons in the old days, they used to go to a theater, and then a group of doctors, they witness this doctor, how he works, and then they say that he's a good doctor, and this is the way they licensed the doctors in the old days. Then it was evolved to an exam and licensing and so on and so. Similarly, the way of treating the patients, it was basically herbal medicine. It became then to modern medicine and so on. And then we are back again to the herbal medicine issue, and then now there is a talk and debate which one is best and so on. So at the same time, in the technology, there was lots of things issued as well. Patient was approaching the doctor in case of symptoms and talking to the doctors personally. They talk to each other, and then the doctor tries to get the best treatment to the patient. Then it became online tools that doctors, they seek some devices to make sure that their diagnosis is right and their medicine is right. Then became to different platforms that the patient can use and the doctor they can use. It became to personalized, that you can nowadays check your blood pressure, blood sugar, and so on with a simple device. So again, from big device to now to a small device in your hand. What are the challenges now in IT? We have this use of health records, cybersecurity, healthcare reform, the cloud, storage infrastructure, clinical data analysis, patient engagement. It's lots of IT challenges in healthcare, and not yet been all of them solved, but all of them now been working together, the safety of the patient and the quality of the big doctors. So blockchain came to talk about some issues. One of them is the security. Today, this, if you see it, it is the actual fact today that we have lots of information in our systems, and we couldn't group them together to make analysis. And one of the simple things, you cannot share your information, or patient's records cannot be shared between two clinics or two hospitals. If you ask the patient, he will tell you, no, I want my information to be shared so I get best treatment. Then there comes the legal aspect and so on and so. So there's lots of complexity in the system, and also lots of systems available. There's disease management, care management, performance management, and so on and so on and so. They're just complicated. So what happened? We said, let's group all of them together and become a one healthcare platform. So whenever you go to visit a doctor, all your information is logged into a system that you can see the patient records, his history, and so on and so. But yet, still the information is not shared. So if I go to hospital A, I see my doctor. If I go to hospital B, they will ask my blood investigation, x-rays, and so on to be again because they say we don't trust, or they want to make more money, or they say that the investigation was not accurate or not requested on the right approach. These are few studies with the reference, which shows there is lots of cost growth opportunities in blockchain, and also the future of health IT. Today we need to talk to each other. We need the doctors talk to the doctors. We need patients talk to different doctors. And also we need systems to talk to another system. Let's give me a simple example. If I block a doctor for malpractice in Dubai, if he or she goes, maybe say, let's go to UK, they will not know whether he was blocked and what was the reason. They will just present their papers, they get licensed, they work, and if somebody will meet them or they are in the news, they will go to the regulatory body. I hear that this doctor was banned, stopped from that country, let's investigate. This is one example which is frequent, it's happening in many countries. In fact, I was attending one of the conferences and by chance I met a doctor. He was in charge of the regulation, I think it was in Scotland, and he told me there's a doctor working in Dubai and he's been banned. When I was chatting with him, he was banned from 5 countries. So he went to 5 European countries. Every time he changed the information. And then when he was banned across all Europe, he came to Dubai. And when he came here, he started to work. What he used to do, he used to clean his records for 2 years and then apply for the license. And he knows the laws that say, we only check the last 2 years of your history. So when we checked the file, we found that, yes, this guy is forging his documents. He even forged his passport name, the spelling, and everything. So he was a really clever guy. But we caught him finally. But why? If we do have a solution like blockchain, I think we could caught him easily. We could understand what's happening. So these are a few examples about blockchain. Currently, we are tying up with the other governmental entities in Dubai. And we do sign with our partner, Dubai Health Authority, to have a blockchain resources. And the first move was to check the licensing. For example, if a doctor will license with me, he will apply his passport copy, degrees, and experience. If he goes to another authority in Dubai or outside, he has to present all the papers. So with this blockchain now, we are able to exchange the information and the doctor does not need to apply again. Simply, we just ask for his last good standing and so on. And this has been active. We are now going for the next round, which is the other aspects of documentation and how to make the process easier. And of course, comes the issue of transparency, security, trust is always around these 3 parameters. But successfully in Dubai, we could battle these challenges, alhamdulillah, and we are moving forward. We'll give you some few cases here. So this is the one I spoke about, our deal with Dubai Health Authority, that we tied up with them to ease the process of licensing the professionals. Of course, it will make the decision-making faster, reduce the time, and of course, will save a lot of cost. Second one I think we did is the records of the malpractice. Yes, I'll give you examples in our area so you will understand what I mean. When you insure your car in Dubai, currently you don't need to go to every single insurance company and check and take the paper and go to the registration and give them that paper. Now currently what happens, whenever you're insured, that paper goes into a system. That system is already available in all the insurance companies in Dubai, so they will get notified that your car is insured, and of course the registration will get notified, and simply you just go and take your card for registration and that's it. So you don't need to do any efforts. This is a similar way, which is called doctor malpractice insurance. So when any doctor or any healthcare professional wants to get insurance, nowadays they have to go to the company, register, pay the money, and bring that certificate to us. Then we upload it in the system. What we are doing now is basically, this will all be vanished. All the insurance companies will be in the network. Whenever any doctor is insured, they basically can pay online. The moment they are insured, this certificate will be floating in the blockchain. So if I want to check whether his insurance is covered or not, I simply click and I can see in the blockchain. And of course, it's available and visible to other authorities. Also, the Universal Commercial License Registry, I think this is still we are working in it. We are moving to the paperless company. We have around 30 free zones in Dubai, different trades, and the owner is basically sometimes having many business aspects in different free zones. For example, we are healthcare, he might have a hospital, but in the industrial area he has another industry. Then he goes to another market, he have another company for cargo, but it's the same company and the same owner. Currently, he has to register every single free zone. With the blockchain, again, it will be easier. The moment they register with us, we have all the information. If he will open another company, different free zone, he will just give us a passport copy or ID. With that one only, we enter his information. The blockchain will take all the information ready in the system, and that's it. So he can be registered within a few hours, of course, instead of few days and few weeks. So healthcare leaders, they must build a collaborative environment, staying abreast of changes and implementation. It's very difficult in healthcare to build blockchain, not because of the system issues or system challenges. It's basically the laws and regulations a lot, and when it comes to patient rights and patient protection information, and then comes with the authorities, how to dispose information. And even when you revoke a license of professional, they can't give all the information to the other body. This is not only in Dubai, this is worldwide what we faced. When we try to reach any other country, it's the same challenge. I think blockchain will definitely evolve in healthcare, and I think it will come really strong. It will definitely change the whole way of dealing from now on between patient and doctor and system. I was just quick because I know it's a long day for you, so thank you very much. If you have any questions, I'm free here. Thank you. That's it. Any questions? I'll just, please, the big guy here. You can ask and I'll...
My name is Manav. So like you mentioned, due to the legalities involved in sharing a patient's data with, let's just say, other healthcare providers, and then I think the ecosystem and the regulation is not in place yet. How long do you think before, at least, because now I think UAE leads the way in practically all the blockchain use cases, how long before you think that UAE, like healthcare in UAE would be a reality?
Today I was reading in the news that His Highness Sheikh Mohammed was saying that I am ready to break all the boundaries to reach to my people and make life for them easier. Which means that the laws and regulations are there not just to keep it for ages. It depends on the country, on the people to change it. We believe in UAE and specifically in Dubai that we need to think out of the box and get things done. Some countries you will find difficulties, some countries you find easier for them, some authorities you will find in the same country difficult, and some authorities easier. For us, we have a clear mandate from the government. No matter what you have difficulties, you must cross these difficulties and do it. And it's happening basically. We signed the contract physically, and yesterday I was, for example, with the Department of Economy, and we're moving forward even to sign for the commercial registry. So the time frame varies between country to country, authority to authority. It depends on how they're ready. Even if they have the law will allow them, there's another issue of resources available, expertise, and willingness to change. So all of these are bound together will frame the time itself. Yes.
So thank you, very interesting, amazing presentation. My question is, did you use self-sovereign identity for the implementation of these use cases?
What do you mean? In what case?
So zero knowledge proof, like because they are all like a little bit registry and identity, and somehow. And so I'm from Switzerland, also working for a state-owned company, and we're working on similar use cases. So that's why I'm asking.
At the current state, what we are doing is a testing phase between system to system, not patient to doctor. It's basically regulatory body to regulatory body. So if I license a doctor, there is Identification from the staff. I do have this registration, I have this ID, I will enter the system, so information is protected. Once we finish this testing, we try it in the market. Once we make sure it's stabilized, now we are moving forward to how to give it to the patient. So if I'm a patient, let's say you are my brother, and then I give you my ID. So you can easily open my information, take everything you like, give it to someone else. This has been a hot talk now, how to secure the information from the patient himself, and how make sure that he, the only one, can access this information. So there is many ways. It's not only by fingerprinting or national ID or something. There's different techniques. We did not reach this level yet because we're trying to make sure, first of all, the system is stabilized. Because as I said, the blockchain healthcare just is new, it's fresh. Many companies are coming proposing solutions. But what is keeping us a little back, we need to make sure that this system is robust and it is effective for the safety and security of the patient information. So currently it's going to be system to system. We're going to give it a try for 6 months, maybe 8 months, and see. Once things are stabilized, we're going to move forward between doctor and then patient and doctor.
Thank you.
You know, regarding today morning, we had a discussion about permission, list permission, and so on.
Yes.
And I think now you talk about very much permission platform. What is the consideration you have taken during your choosing or selecting a platform? Because this is very important.
Technically, I'm not sure. I'm not an IT guy.
Okay.
So
Okay.
what my job comes that, listen, I want the system there.
Yeah,
I want it
okay.
robust, strong, and I want it extremely easy.
Okay.
Because the patient and the doctor, they don't have time to go technically to the system. Specifically, the doctors, they hate computers. I'm a doctor, and I know.
Yes.
They hate computers, but they love mobiles. So if you want to make life for them easy, you must make a system that they can use it and they love to use it.
That's right.
At the same time, the staff who are going to use this information, they are not all of them IT expert. They're normal individual staff who works with papers, and they are basically transferring them from another to another new knowledge and expertise. So what is my duty comes that make things life and easy for them. Now comes the another duty of regulation of IT itself.
Yeah.
We have two things coming. One is a law. There is a federal law coming soon in UAE. It talks about the security and IT and use of information for the patients and how to use them.
Like
and
the
how to
HIPAA.
Yes, of course. So this is this law is talking about all the cases.
Okay.
Secondly, it comes from the local authorities themselves how to define. Let's say I'm in Dubai and there is another one in Abu Dhabi.
Yeah.
Sometimes there is some maybe political decisions.
Okay.
Sometimes there is economical decisions,
Yeah.
commercial decisions that, listen, we don't want to expose this one, but we can expose this information. Sometimes comes WHO issue. That
Okay.
how come you expose these? This is a public health right, this is not.
Yeah, okay.
So currently they're addressing these things, but this comes between local authorities themselves. What we care basically is that whatever information is there, make it accessible, easy, and successful.
Okay. Thanks a lot.
Thank you very much. Thank you.